Childhood vaccinations. Are they really that important? My name is Erin King, and I'm a nursing student with Indiana State University. I ask that you pause the video at this time and take the pre-test. Population at risk. There's an increased risk of preventable childhood illnesses among unvaccinated individuals related to lack of education regarding vaccines and how they work, demonstrated by lack of trust or access to healthcare providers. Approximately 42,000 adults and 300 children in the United States die each year from vaccine-preventable diseases. Vaccinations during childhood is an effective way of preventing serious childhood illnesses. Education and access to vaccinations is important. Some people do not have access to vaccine because of poor quality health services, distance from their home to a health facility, or lack of money or insurance coverage. Some parents do not trust vaccines or even the healthcare worker who provides it. Some parents do not see the need to vaccinate their children at all. Some may not have been educated on how vaccinations work or about the diseases that they prevent. They may also have received misleading or incorrect information regarding vaccines. Our hope is to educate you further in this topic today. A question that is often presented to healthcare providers is, will a vaccine harm my child? Infants and children are exposed to thousands of different germs every day through food, through the air, and things that they may put in their mouths. Most germs are easily handled by our children's immune systems that they are born with. However, there are some diseases that can be fatal if contracted that our immune systems just can't handle. Vaccines protect our children by using a small part of the disease called an antigen. This helps their immune system to recognize the disease if they encounter it again and begin to fight against the illness. The number of antigens found in vaccines is minute compared to the number that children encounter in their environment daily. Another concern that parents may have is that vaccines aren't tested well or they're rushed through the manufacturing process. Before manufacturing begins on vaccines, the Food and Drug Administration oversees several years of testing of the vaccine in a lab setting. After the lab testing is complete, clinical studies are done on people for a few more years prior to making the vaccine licensed for public use. Once a vaccine is approved and begins administration, there are multiple federal agencies such as the FDA, CDC, and NIH monitoring its use to ensure that there are no potential safety concerns. This is a chart that represents the recommended vaccine schedule for ages birth to 6 years of age, put out by the Centers for Disease Control. The CDC recommends vaccination for 14 different diseases that are dangerous and even deadly. The first of these is chickenpox, which can lead to a rash, headache, fever, fatigue, infected blisters, bleeding disorders, brain swelling, and pneumonia. Diphtheria causes a sore throat, mild fever, weakness, swollen glands in the neck, swelling of the heart muscle, heart failure, and can lead to coma, paralysis, and death. Hib may not be any symptoms at all unless the bacteria enters the blood, but if it does, meningitis, which is the swelling of an infection of the covering around the brain and spinal cord, intellectual disability, life-threatening infection that blocks the windpipe called epiglottitis, and pneumonia and death. Hepatitis A and B may also have no symptoms, but then they can have fever, headache, weakness, vomiting, jaundice, which is yellowing of the skin and eyes, dark urine, and joint pain. Influenza is another disease that's recommended vaccination against. It causes fever, muscle pain, sore throat, cough, extreme fatigue, and can lead to pneumonia. Measles causes a rash, fever, cough, runny nose, pink eye, and can lead to brain swelling, pneumonia, and death. Mumps causes swollen salivary glands, which are under the jaw. fever, headache, tiredness, muscle pain, and can lead to meningitis, brain swelling, and inflammation of the testicles, ovaries, and can cause deafness. Pertussis, also known as whooping cough, is a severe cough with a runny nose, can cause apnea, which is a pause in breathing in infants, pneumonia, and death. Polio, which may initially have no outward symptoms, sore throat, fever, nausea, headache, can lead to paralysis and death. Pneumococcal, maybe no symptoms, can lead to pneumonia, bacteremia, which is a blood infection, meningitis, or death. Rotavirus is severe diarrhea, fever, vomiting, with dehydration. Rubella sometimes causes a rash, fever, swollen lymph nodes. This is very serious in pregnant women as it can lead to miscarriage, stillbirth, premature delivery, and birth defects. And finally, tetanus. This causes a stiffness in the neck and abdominal muscles, difficulty swallowing, muscle spasms, fever, broken bones, and difficulty breathing, and can lead to death. This is why you see the severity of all of these diseases and the importance of getting vaccinated to prevent them. Some parents like to spread out the vaccines, but why is it important that we follow this vaccine schedule? Ideal timing. CDC's recommended immunization schedule is based on how your child's immune system responds at various ages and how likely your child is to be exposed. This ensures that your child is protected from 14 potentially serious diseases at exactly the right time. It prevents complications. There is no data to support that spacing out vaccines offers safe or effective protection from these diseases. Infants are at highest risk of serious disease complications. If you delay vaccinations, your baby could be exposed to diseases at the time that they are the most vulnerable. Early protection. It's best to vaccinate children before they're exposed to dangerous diseases. You also want to allow the vaccines time to work prior to potential exposure. Long-term protection. Vaccines protect your baby when your maternal antibodies wear off. Children who are not vaccinated against dangerous illnesses are not only at risk at contracting these diseases, but are also at risk at passing it to others around them. Where can I learn more about vaccines? It's important to review vaccine information provided by your child's healthcare provider prior to their vaccination visit. That way, you can get any questions or concerns addressed prior to the vaccinations. Parents typically want information about both the benefits and risk of the vaccinations presented in a clear and simple manner that can be reviewed prior to their vaccination appointment. Many healthcare providers have clear vaccine information on their websites or will provide links to reputable sites for vaccine information. On this page, I have provided internet resources for more information regarding vaccines for children. They include links to the CDC's information about vaccines for your children, a link to the FDA regarding vaccines for your children in its A Parent Guide, and immunizations on healthychildren.org. Thank you for viewing my presentation. Please don't forget to take the post test.